Tired of knee pain holding you back in 2025? Whether it's from running, sitting too long, or just everyday wear and tear, knee pain does not have to be in your future. In this video, I'll show you the top 5 tips to prevent knee pain before it even starts. Simple stretches, exercises, and daily habits to keep your knees healthy and pain-free. I'm Dr. Tammy Penhollow, a spine and knee pain specialist of Precision Regenerative Medicine. Don't wait for the pain to strike. Learn how to protect your knees today. Hit subscribe and let's get started. The top 5 things you can do to help prevent knee pain are: number 1, look at your shoes. Look all the way at the bottom. Let's start from the bottom because every step you take, translate this up through the ankles into the knees. So if your shoes are overworn, if they are worn out because you walk on the outside of your feet, then that's going to put extra wear and tear and strain on the inside of the knees. If you overpronate, oversupinate, if you're not wearing enough cushion, if you actually have too much cushion, believe it or not, we need a perfect heel to toe strike through liftoff. We have a great episode to look at for very specifics of this. It's with a podiatrist. Her name is Dr. T. Wynn, and we dive deep into the causes of knee pain that originate in the foot. So that's number 1. Number 2, get your gait analyzed. This can be done most appropriately by a physical therapist. We did an episode with James Babana, PT, DPT, and we talked about how running and knee pain are related, but it was really all about bringing it back to the way you walk. I'm not saying you have to be a runner, but to have that walk analyzed. I look at it on a new patient consultation. I look at the shoes. I look at how a person may be angled. For example, women with a wider Q angle, this is the hip, this is the knee, is going to put more wear and tear on the inside of the knee. If a person is bow-legged, it's going to put more wear and tear on the outside of the knee. If it's something where you've got a hip replacement and there might just be even a half a centimeter or a centimeter of a leg length discrepancy. You've had a short leg that you were born with, or you had a fracture early on and have a rod in your femur, or you've had a knee replacement, an ankle replacement, an injury to one of those joints. It could change the way you walk and you compensate, and that can put strain very specifically on the opposite knee. So having your gait analyzed. Number 3, look at what you're putting in your mouth, from water to food to alcohol. Look very specifically for hydrating. Every single aspect of your knee needs hydration, from the joint fluid, the synovial fluid, to the ligaments, to the meniscus, and the bones need all of that hydration as well. When we eat anti-inflammatory, then we are decreasing the amount of circulating inflammatory substances within our blood, and the joint gets that blood. The joint wants to see healthy, non-inflammatory blood. In fact, we won't even take your own cells until we know that the cells aren't inflammatory. Otherwise, you're just putting inflamed cells into an inflamed joint. You're not going to get the kind of results you want. And that's why so many people fail treatments. That could even be a joint replacement. That could be steroids. That could be platelet-rich plasma, bone marrow, or adipose. We did a great interview with Carrie Camp. She's a certified health and wellness coach, and we dive into anti-inflammatory eating. Look at that one. The number 4 thing to do to reduce knee pain in 2025 is be active. Get up and move. Even if you have a sedentary job or a sedentary life, you can still set a little alarm that every hour you get up and stretch for 5 minutes. You stand, you walk around, you change position. That's when you could be standing up and doing that wall sit to bring the quad muscles extra blood and to strengthen those quad muscles, because you're using your own body weight to help build those. You can watch your alignment of that. You can watch the knees not extending over the toes and staying at that 90 degree between the back and the hips to the knees down to the ankles. So be active, cross train. Don't always just walk. Add in something like stairs, do some jumping jacks, do some plyometrics, do different things so that we don't get repetitive injury. Runners get runners injuries, bikers get bikers injuries. Keep active. The fifth thing you can do is stretch and strengthen. A healthy joint is strong. A healthy joint has strong muscles stabilizing it. A healthy joint is hydrated and has supple and very strong elastic ligaments protecting it and strong elastic meniscus to cushion it. So doing a regular strengthening and stretching, waking up in the morning, doing some very specific things to warm up the joint, then move into stretches. Lift heavy. Heavy means that you can only do a few reps before you fatigue, a few ideal reps where you're actually safe and you're not putting the joint under undue stress because your mechanics are out of whack. We want to build the muscles, and that comes back into the eating aspect with eating enough protein, because remember, the amino acids are the building blocks for muscle. Amino acids come from protein. So having a high protein, enough for you, let's probably aim for 100 grams a day of protein, will then allow you to have muscles that are stabilizing the joint. Look at any muscle imbalances, because say you are chronically tight hamstrings, work on stretching those hamstrings out, work on making sure that the medial quads or the vastus medialis are balanced with the lateral quads or the vastus lateralis. Otherwise, if the inside is weak, then that puts undue strain on the medial side of your knee. And we already know that most people develop medial or inside knee arthritis first. So there's so much we can do to help prevent the pain from even developing in the first place. If you like what you hear, please subscribe. There are so many videos that we've already done that I'm alluding to right here, and we'll also link to them in the show notes, specifically for the podiatrist, the physical therapist, and the certified health and wellness coach. Thank you. If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.